Hello. Welcome, welcome, welcome. We're waiting a couple more minutes to let people get in. Thank you for joining.
This.
Hey.
Hey.
Can you hear me okay?
Yeah, I hear you good.
Good.
While we sit here, I'm gonna go ahead and add some of my friends. Hey, Margaret.
Hi. Yeah, I'm trying to open the link on here so I can see.
Okay.
Amara, turn your volume down. I don't know why the screens look like that. Hello. Hi.
Hello.
Our screens look crazy.
It does.
Mm-hmm.
Margaret, can you see both of us?
See, they got us on top of each other. Hi. Thank you guys for joining. Oh, we got three.
What?
I don't know what's happening, cousin.
Huh?
Huh?
What you say?
I'm trying to figure out what's happening with it.
Good evening.
Hi.
Can you comment in the bottom if you can see both our faces?
Yeah, can you see both of our faces on here? It's
Yes,
almost to the
of
top.
her
That's why I said
head.
it. I can only see the top of my head. I don't know what's happening.
Just
Is that
maybe
better? Make this better.
okay.
Thank you,
And
thank
you
you,
know, of
thank
course, I
you.
can't see.
Yeah, I know you can't see. Thanks everybody for joining. We appreciate you guys. We do want to make sure we are being mindful of your time. My name is Leona Wells. This is gonna come.
Yeah, it's lagging a little bit.
It is, yeah. Something's happening.
Okay, they see both of us.
Okay. Thank y'all for your patience. I'm trying to get it together. Okay, that's better. All right, my name is Leona Wells. I am the founder of Wells Wellness Advocacy Services. We have on here Melissa Wells Woodbury. I actually started Wells Wellness Advocacy Services because I felt like every time I went to the hospital, a family member went to the hospital, or a friend, we have some type of story about, not quite understanding, what's going on, whether or not is having ringing in our ears and not feeling listened to. And I have a master's in public health, and so I wanted to use my knowledge to be able to help other people. So without further ado, we'll go ahead and get started. Let's get to my stuff. Of course, if you have any
You're
questions
breaking
or
up,
anything,
Leona.
is breaking up.
Yeah. I heard the gist of your introduction. Some things was left
See if
out.
that works. Is that better?
Okay. That sounds great.
Sounds great. Okay, fantastic. Did you see the whole, you hear the whole thing? Melissa, I need to start over.
Yeah. Yeah. We heard most of it. Yeah.
Okay, that's good. All right, moving right along. So what we have here is my cousin Melissa Wells Woodbury. She's also going to be helping me with this. I'm so excited about that. We do have a website. Drop your questions down in the chat if you have any. Tonight is really just a major launch opening. We want to help as many people as we can. So of course it is a business, but tonight free questions. If you have any, we'll try to answer them for you. Going on. So Melissa is going to bring the vibes. What we want to start with is some myth busting trivia. So a lot of you guys know about healthcare. We want to go ahead and start with some different things, some different myths, and then making them up. So Melissa, if you could start with the myths, I'll give the whether or not they're myths or facts.
Okay. The first thing it says, my doctor has all my records, right?
Nope. Your doctor does not have all of your medical records. Of course, you go to the eye doctor, you go to the dentist, you go see your cardiologist, and depending on what kind of network you have, all of your medical records may not be together. So it's very, very important if you get a new physician, a new medical team, that you're transferring your records over to another doctor so that they can be able to provide you with the best care for the totality of your well-being. All right.
So how do I request my records?
Oh, you can request your records by filling out this document. Usually every doctor's office has one. You can actually get that document from your actual doctor that you currently have, or your new physician will have a form for you to fill out. They will fax that information over to your team saying that you agreed to have your records transferred. It does have a document on there to let you know how much of your medical records can be transferred. So it is all your choice. You put that information on there, and they'll transfer your records over. Sometimes it does take a little bit of time to get them transferred, but just good planning will help with that.
Okay. Back up. Okay. All right. Any questions on that one?
Questions.
Okay. Here's the second one. Are we ready?
Yeah, I'm ready.
If it's on my bill, is it correct?
No.
What?
Just because it's on your bill does not mean it is absolutely correct. A lot of times, actually, and this is one of our questions later on, a lot of times that the codes that they're putting in, they're moving very quickly in those doctor's offices. They're, seeing you, they're late. Your appointment was at 10:30, it's 11:30, they're coming in there, they're behind. So they're putting those IDC, what they call ICD 9, ICD 10 codes in there, and that's what prompts the billing for you. So it could be off by one number and it's a totally different diagnosis and you're getting billed for that. So yes, no, absolutely not. You should look at your bill very thoroughly to make sure that you receive those services that they're saying that you received.
Okay. All right. So the next thing is, anything that I want done, my insurance company will always tell me what's covered and what's not.
No, they will not. They will bill you according to whatever it is. So if your copay is 20%, or if it's not covered, they're going to charge you 100%. So unless you call the insurance company, if you know you're going to have a procedure done and you're like, I'm supposed to have this surgery coming up, let me call my insurance company and see how much my out-of-pocket costs are going to be. So you definitely want to make sure that you're reaching out to your insurance companies ahead of time. And again, that's why we have Wells Wellness Advocacy Services, because that's what I will help you do to make sure that you're understanding what your costs are going to be and that you're not shocked after you're trying to feel better after having some type of procedure or anything done, especially with the rising cost of insurance.
Amen.
Yep.
Okay. The next one.
Mm-hmm.
I I can't, my doctor, they're going to get offended. I can't ask them this and that. They're going to get offended.
Woo. You better
I
ask those
can't, the
doctors
doctor.
any questions that you have about your care, your well-being, your health. Make sure you ask those questions. That is your body. You know what's going on with you. I don't really care how busy they are. Get your questions in, because at the end of the day, you still gonna pay that copay. You still gonna get charged for coming into that office. So make sure you ask all of the questions, even if they have walked out of the room and they've gone to the next patient and you have a question, ask your question. And of course, I'm here for you. I will help you get those questions asked.
Okay. So if I have an insurance claim and I want to appeal it, sometimes I feel like it's pointless.
Yeah, no. If you have errors on your bill, you should always appeal them. Now, it does take some time, because a lot of times the first time around, they're going to reject it. They're going to reject it because 9 times out of 10, we, the consumers, are too busy to go back in there and actually do the appeal again if it's rejected the first time. Definitely, we want to appeal it. And this is what I would actually help you all do with Wells Wellness Advocacy Services. I will help you get your appeals through. I will help you ask those questions if you have additional questions about your well-being, connecting your teams together. That's exactly what we do over here.
Okay.
All right.
Okay.
What you got?
If the doctor didn't mention it, does it matter? If he didn't bring it up?
Absolutely, it matters. It
Okay.
absolutely matters. Again, the doctors are working on a little bit of time. They may already be late. So it is absolutely important that you mention those things that you have questions about. So maybe your last time you was in your doctor's office, your cholesterol was a little bit high. They didn't mention it this time because you actually didn't meet the criteria to get cholesterol medication. Maybe you were right there borderline. Please, please, please make sure that you ask those questions. You know, maybe they're doing a wellness visit. Can you please check my cholesterol again? Last time I was here, it was a little bit high. I just want to make sure. So you can advocate for yourself, or call us, and we'll help you get those questions answered and help you through those. You definitely want to ask every single thing. If you had previous tests that was just borderline, you can ask them. That's what they are paid to do. They're providing the service to us, so we definitely want to make sure we get our money's worth. All right, Melissa,
Okay.
what you got?
Well, speaking of preventive care, does my insurance cover that?
So preventative care is covered unless you get a diagnostic. So say if you go in there and you was like, oh, I'm just getting a wellness visit, and then you decide that you need to get a chest x-ray for whatever reason. You're probably going to have to pay for that. So those are the types of things you want to know before you go in there. That's one reason why before you make your appointment, they always ask you, is this a wellness visit? Is this a sick visit? And they ask you these series of questions like, what are you being seen for? Because they try to get those codes and billing together right before you get into that office.
Oh,
Yeah.
okay. Didn't know that.
Yep.
Okay.
Yep. Yep. Let's get Melissa, you there? Can you hear me?
I'm here. Okay.
Okay.
So the next one is second opinions. Are they only for serious conditions?
Second opinions? Oh no, second opinions
So if
is
I,
for
yeah.
any questions that you have or any second, information that you need. If you think your blood pressure is high and your doctor is saying that they don't think it's that high, and you know your body, it's still in the normal range. So, your blood pressure is still in the normal range, but it's high for you because you know your body. Yes, definitely go get you a second opinion if you feel like they're not necessarily listening to you. You know what your numbers usually are. You're at those doctor's visits, and those doctors are not. So definitely make sure you get a second opinion for anything if you feel like you need one.
So if I have a primary care doctor, right? Where do I go to get a second opinion?
So you can actually use your doctor's office actually can refer doctors within their office to see you. A lot of times if you say, hey, I would like to have another second opinion, do you have a team of doctors that we can talk to? Or with Wellness Advocacy Services, I actually can look in your area and see what doctors are available for PCP in your area. And we can talk through what is a good fit for you. What are you looking for? Whether or not you're looking for a woman or a man, someone Black, white, Hispanic. Those are the things that I can help you look for so that you can get the perfect fit for your PCP if you're looking for a new one.
Okay, so you can help me find a person. Okay,
absolutely.
Great.
Yep.
That's good. Okay. So those are all the myth questions I have at this time.
Thank you, Melissa. So we are going to go over what exactly do Wells Wellness Advocacy Services do. As I mentioned in our conversation that we just had there with some of our Mythbusters, I can help prepare for doctor's appointments, looking at your medical records to see, collaborate your documents and see what's going on, what questions do you have, what do you feel that you need support with. And it's totally up to you. For us, it is important for us to help you with what you need. If you only need me to help you find a rehab center after your procedure, I'll only get information about that. So it's all about you with Wells Wellness Advocacy Services. We don't have to get so much of your information. We get exactly what you want to give us. We help you where you need help. We're trying to fill in that gap of in between the patient and the healthcare team so that you can get the perfect care. You don't have to do all the extra legwork for that. So doctor's visits, care coordination, like I said, syncing up specialist visits, managing your records, helping you get the right questions together, health literacy. A lot of times we sit in those doctor's appointments, you may not know exactly what the doctor is saying to you, and they're too busy to go in depth, or you don't feel comfortable going in depth. That's what we're here for, is actually to help you get those questions answered and make sure you understand what your diagnoses are, your areas of where you're interested in getting more your well-being up. That's what we help you with.
Okay, also, so you say the team. No, the team is going to do the big words, diagnose the big words.
Yes, we help you. We're going to read the big words.
The big words.
We're going to help you. That's right.
All right.
That's exactly what we do. We got that. We got all the big words. Make you know. We break it down. Make sure you understand exactly what's going on.
Great. That's good.
We also look at your insurance billing. Sometimes you don't know exactly what your insurance covers. You don't know what all of your benefits are. You know, can you go get a massage? Can you go do this? And I'm not telling you you can do that because I'm not looking at your insurance records. I don't know what you signed up for. But once I get, your consultation done, I can help you figure out what your insurance covers and kind of help you with those discussions. Also, resource linking. As I mentioned before, if you've had a surgery or a procedure, I can definitely help you go and figure out a rehab center. Maybe you need a ramp at your home because you can no longer walk or something like that. I'm able to gather those resources up to be able to support the patient so that you have a better, better life. I just think we spend so much time doing research. Let me help you all. Like I said, I've done this for family members, friends, and I just hear so many trauma stories. And so Wells Wellness Advocacy Services are here for you to do just that.
Okay.
Yeah.
So I have a question.
Sure.
So if I'm in a work field and I'm working full time, and then I happen to have accident or I get hurt, maybe not so while at work, not workers' comp, but I got hurt and I had to be out for short-term disability. Would you help me with that?
Yeah, absolutely.
Wow. Okay.
Absolutely. There's a lot of documents in short-term disability, FMLA. It's a lot of paperwork, and that's exactly what I'm here for. I'll help you pick up the pieces, get that done. You're already not feeling well. When you have something like that, you really don't. Do you really want to go back and forth to the doctor's office and get this person to fill out this document and fill out that document, and you're not feeling well? That's what we actually do.
Right. Okay. I understand. Any question, guys? Y'all quiet.
Yeah, I got some questions. Uh-oh, did you go mute, cuz?
Oh, I'm here.
Oh, there you go.
We're
There you
moving
go.
right along.
Move right
Oh,
along.
you can hear me? All right. So this is participation for the group now. So y'all want to have some fun. We're gonna have some fun. Now nobody don't have no fun. Okay, wake up. Put a check down in the comments if you ever felt rushed at the doctor's appointment. If you ever went to a doctor's appointment, you felt like they rushed you, put a check in the comment.
Mm-hmm.
Let's see what that looks like.
No, that's right.
Well, let me see. Let me see if I can put a check in there. Let me see.
Oh, they're
Because I
gonna check.
sure,
They're gonna check. They're gonna check. They're gonna check.
I sure been rushed. How you go to it? You go to the emojis. Let me help
Yeah.
y'all find the check. Oh, we can't find the check. So maybe just put a thumbs up. Put a thumbs
Yeah.
up.
Thumbs up, heart.
Put a thumbs up.
Done.
Comment down there. Yeah, I'm gonna put a heart. I
There
can
you
find that.
go.
Okay, guys.
There you go. All right. So you mentioned needle therapy. Give me a little bit more information about that, because I want to be very clear. I am not a medical doctor. I'm not a medical doctor, so I don't diagnose. I don't treat anything. I have my MPH, or Master's of Public Health, which tells me, which allows me to provide education about things. Resource gathering, helping you figure out what you need. So if your doctor has prescribed to you needle therapy, or you're interested in your needle therapy, you definitely want to speak to your care providers to ask them about, needing needle therapy and what it can help you with. I want to find
Yeah.
someone to go to
She said
therapy.
needing therapy about
Oh,
somebody.
needing therapy. Oh, like
Needing,
mental
yeah.
health therapy. Absolutely.
Right. Right.
Absolutely. Mental health, yes. Mental health therapy, yes. I can actually find individuals within your region, as I mentioned before, according to what you're interested in, whether or not, you want a woman or a male, a certain race, a certain area, maybe you want a mental health professional that actually works online primarily. You don't really want to go into the office. Whether or not you want to do group therapy or not, I definitely can assist with that.
Okay. So back to the question I was asking you guys, have you ever felt rushed in the doctor's office? So Miss
Absolutely.
Leona, can you please tell us how long stay with you in the visit?
So the average time a doctor spends with a patient is between 13 and 16 minutes. That is the average time.
I'll be done check my mail and come back and he gone?
Yeah, that's absolutely right. That's absolutely right. Absolutely right. That's barely enough
13
time to say
minutes. Okay.
hello, explain your symptoms. So that's why you want to be well prepared in your doctor's appointments. Get you an advocate so that you are prepared for your appointments, and you're getting your questions answered, and you're not spending your money on all these co-pays and not getting what you need.
Okay. Okay. True or false? True or false? A health advocate can negotiate bills, your medical bills.
Yep, your medical bills. Absolutely. Absolutely. People have different things. As I mentioned before, there are many times that there may be errors on your bills. The advocate can definitely help you discuss your bills, especially if you can't afford it, to get those minimized and things like that. Absolutely.
Okay. So what is the term for the maximum that you'll pay for covered service in 1 year? So what's the term for the maximum I pay in 1 year?
Yeah, so it's considered out-of-pocket costs. So
Okay.
essentially, your insurance company has an out-of-pocket maximum in which you're allowed to spend on your medical care. They don't want you to spend but so much. But essentially, that's what that is.
So what about I understand about the out of pocket. So where does the deductible come in at?
The deductible is part of the out of pocket. So essentially,
Oh, that
the deductible is what you have to actually pay before they cover any of your bills. So if your deductible is $2,000, you will have to pay the $2,000 out of pocket before it can start covering any of your medical expenses. So usually you have
okay.
to pay that first. So the lower it is, the lower you have to pay. So if $500, you pay the $500, it starts covering the rest.
Gotcha. So the next question is, what percentage of the medical bills contain at least one error?
As I mentioned before, and I was trying not to give it away, but it is 80%. 80% of our bills have at least one medical error on it. As I mentioned before, the doctors are, running and racing and they're doing things, they're putting those codes in there. And it's likely that your medical bill that you have sitting on top of your desk, your TV stand, on your coffee table has an error on there that you need me to help you get off.
Okay. So my last question, if I have a primary doctor, right,
Mhm.
and I know I need to go to a specialist because I have a problem in a specific area, but the doctor refuses to give me a referral, what do I do?
So if a doctor refuses to give you a referral, the first thing you want to do is make sure that they put that information in your chart. So you ask them, say, can you put that information in my chart that you refuse to give me a referral? And when you say that, their eyes are going to get really, really big because they're going to want to know who you was talking to and why you know that. But
Right.
yeah, you want to tell them to put that in your chart. But again, if you still feel you know your body, we know our body. If you feel like you need to see a specialist, it's okay to get a second opinion. You can also ask your physician. Maybe you love him. You've been with them for 20 years, 30 years, but they're thinking that you don't need a specialist. Again, they know they're providing a service to you. They don't live inside of your body and feel what you're feeling. And so you are able to ask, is there any additional tests that we can do? Or is there any, things that I can do for myself? What do you suggest? You're giving me the refusal of a referral. What do you suggest I do for these? And then you get that information. A lot of times, and I do want to let you know, especially now, when you're going into the doctor's office, as soon as you walk in there, sometimes they'll ask you, is it okay if I have my little phone in my hand that's going to record this conversation and it's going to take notes for me? So it's recording what you're saying. A lot of times, if you agree to that, you don't have to agree to that. I want to say that too. If they come in there and they don't want to take notes, that's on them. You can say, I don't want you recording me. I don't want to use the AI system. That's a whole nother side note. But if they do actually record you, you want to make sure you're saying everything in there. Can you put that in my chart? Can you do this? What about this test? What about that? And that's why it's very important to talk to an advocate ahead of time. Not just for complex issues, but for things that may be costly, for things that you may have questions about or that you're unsure about. Definitely get your advocate so that we can help you iron out those questions for them.
Okay.
All right, what else you got, Melissa?
So that's all I have. So now I want to know, how can I get your help? What do I do? How do I get in touch? Like, what we do? How we do? What we do? How we rolling this out?
So what you will do is I have launched a website. It is called WELLSWELLNESSADVOCACY.com. It is still getting little tweaks on there, but you can actually schedule an appointment. Everybody who's been participating in the live, I have had my children in the background collecting your names so that I know that you participated in this live. And if you're interested in getting a 10-minute consultation, I will do that for free. I will do a free consultation with you. You will go to my
Okay.
website, you will put your personal information in there, and then we can schedule you an appointment.
Okay.
All right.
So the free consultation offer, when does it end?
Free consultation ends the February 27th, 28th, February 28th.
Okay,
February
so
28th.
all right, now don't y'all wait the 27 at 11:59 talking about I got one more minute. Go on in there. If you don't have a question, you can just even have a conversation, and then your questions
Yep,
will begin to come after the conversation. So it's just having a conversation about your personal health, what you have going on,
yep.
information that you don't even think that you have questions about. You'll just, you know,
Get the help.
I'm really excited. I'm really excited, Leona, and I thank you for sharing your gift and your knowledge with us. Really, I thank you for basically, people and not making us feel less than, if we don't understand medical terms, you're still a person, but you're willing to teach us the language and teach us and empower us in what we need to do. I appreciate that.
Absolutely. Oh, of course, of course, of course. So I want to let you guys know. So just another tip, right? So I got this advocacy, service business. How do you pay for it, right? Leona, I don't have a lot of money to pay you to, pay you for your services. Some of your insurance has the opportunity for you to seek your own advocate. You just have to read it. That was what I mentioned earlier before.
Mhm.
Sometimes you have those different things within your policies that you just don't even know are there.
Right.
Also, I will be taking fees via well, I'm gonna say the actual term so you guys know. The health savings plans, if you have health savings plans at work or your flexible spending plans, I can take those payments as well. And of course, normal payments. And this is after your free consultation because you may not need that. We can talk about that too. We want you to actually. I want this to be word of mouth. So if I help you, I would ask that you help someone else, or ask someone else to join, so that we can circle this business and everybody can get the knowledge that they need during these appointments. I feel like a lot of people are getting sicker and sicker and busier, and I think it's very,
Right.
very important that we have a great life of well-being. We should not just be sick and take your medication. I want you to be able to get those questions answered. I want you to feel better, feel stronger, feel wiser and more empowered when you go into your doctor's appointments, and not scared because they're providing a service to us. I want to make sure I say that. I'm gonna pause 1 second, Melissa, because I got to get this part out. They are
Okay.
providing a service to us. When you go to the restaurant and you order some chicken or you order some steak and they bring you chicken, are you going to still pay for the steak price for the chicken? You
No.
don't want to pay the steak price for the chicken. So they are providing a service to us. They should have good bedside manner. They should not be talking to you any kind of way. They're supposed to be, it's supposed to be you leading the conversations, you saying the things that you're worried about, and them coming to you saying, this is how we can help you. That's how it's supposed to go. And I think we've kind of gotten away from that. Again, I have over 20 years of experience in the medical field, from clinical research to lab to just extensive background, and I've seen it all. And I just want to be a pillar on our side so that you can feel comfortable getting your questions answered, feeling empowered, not feeling nervous, because you still got to pay that bill. Now, I
Exactly.
can help you get the bill down, but you still got to pay that bill.
Mm-hmm.
So I want to make sure you guys have the information that you need, because we all have to go to doctor's appointment. You stub your toe, you get in a car accident, you get something. We are constantly going to the doctor. You have children, someone got the flu. Right now we're having this big ice storm, who knows? And somebody might drive up the street, drive their car into somebody's house, and now you're ill. So this is why, launched this business, and I'm just really, really excited to help everyone feel empowered to take care of their own well-being.
Right. I see in the comments, Miss Nancy said she just went to a doctor just last month, was very unprofessional.
Yeah, you should have called me, Miss Nancy. I know you didn't know. It's all right. You know me now.
She went got a second opinion, didn't she? Went got another doctor.
Yeah, you know me now.
I got another question before we wrap it up.
Sure.
So if I'm just like a health nut, and I want to try to go get things naturally, and I don't want to really focus on getting meds. I'm trying to heal naturally. So like, could you direct me to like natural doctors?
Yes, there are some holistic doctors. They actually got a new set of doctors. I can't remember the actual coined term right now, but they do have holistic doctors that will be able to support whatever you're interested in. And actually, you really, just to be true and transparent, you should not have to do that. If you have a doctor that you've gone to, I mean, they could say what they specialize in, right? But if you tell your doctor, I really don't want to try, I don't really want a medication, do you have some other alternatives? They should be able to give you other alternatives. And if they can't, then again, they may not be a good fit for you. It may be possible that we need to look at getting you someone else. But yes, there is lots of people, lots of doctors out there who, can help you with that. And I can definitely help you with that.
Okay, good.
Mm-hmm.
Well, that's all the questions I have tonight. What do you think? You think it went well?
I think it went all right. I had some technical difficulties. I couldn't get on my business page. I want to thank everybody who was able to come over here to my live on my personal page. We will be going live again. We will be having these types of conversations. I do want our next conversation will probably be about HSA or the health savings plan and the flexible spending plans, because I just don't know that everybody really, really understand those plans well. And it's a good next topic. So if you have any topic ideas for us, things that you would like us to discuss, definitely let me know. Drop it in the chat. Go to my YouTube page as well as Wellness Advocacy Service. I'm on Facebook, YouTube. I'm creating my page on LinkedIn, and then we also have a website. So definitely drop any suggestions, any questions that you have, and that we'll happy to connect with you guys. We will also use this platform to discuss meet with other healthcare professionals. So I might have another person who has an MPH on here talking to us. I may have some nurses or nurse practitioners talking to us. And so that's what I want us to do. It's about educating and bringing knowledge to everyone so that you can take care of your own well-being, for sure.
Yes.
Well, thank you guys for joining us. We definitely appreciate your time. And we will see you next time. So join our next live, go to our post, like, share, subscribe. Wells Wellness Advocacy Service. Thank you.
Yay, January to the 3rd. We did it!
And it's my mommy's birthday. Yay! Thank y'all.
Thank you.